called a historic meeting. First Human Health and Human Services Board, October 26th. What a great crowd. I've never heard it so quiet here. It's almost spooky. But anyway, we sure are glad to have everybody here. I would like to remind everyone that according to the State Government Ethics Act, it's the duty of every board member to avoid both conflicts of interest and appearance of conflict. That normally takes place when the vote is involved, in case you have a conflict and so forth. Most of what we're going to be doing is listening and getting information from everyone. But if you do have a conflict through the process, make sure that as we go through the agenda that you will let us know that you have a conflict at that particular time. I appreciate it. We're very fortunate to have on this board a member of the Board of Commissioners, and she would like to take a few moments to explain all the meetings. So, Carol.
Absolutely, and welcome everyone. This is a historic occasion. Those of us who've been sort of in the trenches to get to today, we're the ones who are grinning, and we're grinning in pink. So it's great. We are, as Board of Commissioners, we have asked all the folks who work in Buncombe County, who you will get to know are the best people in the world and the hardest working folks in the world. We've asked them to come to work today in pink because we are so supportive of the fact that this month is Breast Cancer Awareness Month, and we want the community to know that we are definitely in the corner of the folks who have breast cancer, in the corner of the great work that our health department and our health and human services folks are doing as far as taking care of people in Buncombe County, getting them screened, getting them treatment if we find they have breast cancer. We try to be on the ground and running with all problems or situations that our citizens may be involved in. So we're in pink today. We're proud you're here. You have a pink shirt probably behind your chair. You can feel free to put it on anytime. Please put it on over the clothes you have now because we won't have any stripping. But on behalf of the Board of Commissioners, this is historic. I couldn't be prouder. You are on a historic board. We do great things. You will hear we're a national model here. Thank you so much for being a part of that.
Carol, I appreciate that, but I need a parachute to put over everything. So we'll try to go away from it. 2 or 3 things I think that we need to discuss before we get into the next area. That is the fact that I guess you know that we are being recorded. Everything is also going to be a production and will eventually show up on the county channel. So be careful what you whisper because we have very sensitive mics. It has all been done, and we certainly appreciate the IT doing it, putting it together, and making this possible. We do have TV screens in case you can't see somebody close enough or whatever it might be for you. And so as a result, that would be important. Another thing that I want to make sure that you understand as a board, it is a large board, and because it's 19 of us, and because of that fact, we will definitely have to use Robert's Rules of Order. And so we will make sure that we follow that situation as far as if somebody is presenting and directs a question to someone, I will take the question and present it to whomever. If we have staff member who are presenting and you have a question, they will be able to answer that question without going through me. So, and we want to make sure that as a board, we take the time to help and to give our input on all these issues that's going to come forth because there are like a lot of them. And as a result, want to make sure that you know that. One other thing that just a tidbit, I like giving tidbits every now and then. In Robert's Rules of Order, if you're going to bring business, some kind of a business to the board, and want to put it forward in motion, you always say, I move. Most people say, I would like to make a motion. But properly, I move. Now, if you say I'm going to make a motion, I'll accept it, but I just want to let you know there is all these little funny things involved. Another thing that I want to make sure, a lot of you are coming from your business and you must wear that particular uniform for that day, please feel free to do that because it's important that you come and don't worry about not having the right attire and so forth. The only thing that we would request is Dr. McLean wear his mask with him every time he comes. We'd appreciate that.
Maybe not.
Well, anyway. We look forward to you understanding that particular process. I want one thing for you to know. Some of us have been fortunate to be on either the DSS board or the health board, or maybe some of us on both. Now, what I would like for you to see right now, as far as looking at the people with you, for those people who have been on either on the health board or DSS board, please raise your hand. Now, I want you to look because we should have somebody pretty close to you to where if you need some help, need some whatever it might be, you will have an opportunity to utilize it. So let's see if there's anything else I can think of that we might need to know. Oh, I know one thing, that if you don't like the person sitting next to you, make sure you tell them first before you tell me. And I will move them. One thing you're going to find out, this is a great group, and I've had a fortune of meeting a lot of you, and I think it's wonderful. I very seldom will think we'll find somebody that you don't like sitting with you, but welcome again. Thank you so much. One of the things that we like to do is to get to know everyone and have an opportunity to hear your situation and so forth. And so we have provided a little sheet of paper as to what we'd like for you to discuss as we get to your name. And we'll do the board first, and then we'll get to the staff. They're sitting at the head of the table, we're at the foot. Usually I'm going to start it off. My name is Bill McKellar. I'm retired. So I have no organization except Buncombe County. I think the world loves Buncombe County and everything it stands for. And as a result, that's my organization. My title is retired. And I used to be at one time with the school system, Buncombe County, for 33 years, and with the county manager's office for 8 years. One of the things, what do you value about this community? I value about this community that we have a board of commissioners and a staff that had the courage to keep trying to make this happen. I think it's wonderful. It's been 20 years when we first started for this to become available. And I'm just glad to know that people in the right positions made it happen. And I'm looking forward to it. Now I'll go to let Vice Chair Suzanne.
Welcome. Thank you for being here. I'm Suzanne Swanger. I'm the Associate Superintendent for Buncombe County Schools, and I have been a member of the DSS Board and Health Board, so I'm glad to be here. Buncombe County is a wonderful place to live, isn't it? And we take care of our people, and I think that's the most valuable thing. All ages, all sizes.
Sharon's not here. I'm David McLean. I officially was asked to do this initially by the Medical Society of Buncombe County. And I'm an infection doctor, which they thought I would help stem epidemics that came out of Gibby Harris's shop, I think. But what's happened over the years is I've learned more about the DSS and taking care of a number of patients without healthcare resources is the nature not only of my practice, but most doctors in Buncombe County. It's really been a privilege for me to learn about the resources that our county directs to people who don't have a lot of other social support. So it's really been an encouragement and a lot of fun, and I feel very, very grateful. Carol has a lot to be proud of in regard to the people that work for Buncombe County who have work.
One thing I'd like to, Suzanne and Dr. McLean have both been in the chair of the health board, so I want to make sure that they understand that. Frank?
Hello, my name is Frank Castellanco. I'm the Director of Cardiac Emergencies for Mission Health. I'm a nurse, and I set up systems of care for any kind of heart attack, cardiac arrests, aortic dissections, anything that happens emergently in the region, so for all of Western North Carolina. And I also do heart outreach for the hospital, and so that's connected to something I'm very passionate about, which is our diversity, our cultural diversity here. So that is what I value most about Buncombe.
Yeah. Yeah, my name is Candace Toole. I'm the lead school psychologist for Asheville City Schools. Brief description of my role. I'm involved primarily to work with at-risk children, but in general, all children to succeed, including, with their family, the support of their family, and the educators, for, all children to be successful in school. What I value most about the community is the diversity, the progressiveness of Asheville. I love it here. What's not to love? I moved here in 2004, and it feels like home. It's accepting. It's the environmental consciousness of Asheville. And again, I'm just happy to be here.
My name is Ken Putnam, and I'm retired from the North Carolina Department of Transportation, and I'm currently the Transportation Department Director for the City of Asheville. So I'm the engineer for the group. What I value about the community is this is my home, this is where I grew up. I moved here, my family moved here when I was 5 years old, so all of my childhood memories are here in Asheville. I remember before there was no open cut. I remember when there was no mall. Everything was downtown, so that's, I wouldn't want to live in any other place.
My name is Glenn Ziegler, and I'm a nurse. I moved to Asheville 27 years ago, and I consider it home. I was everywhere I've lived. I've lived all over the world. I went to school outside London, and I'm also Canadian. My father is English, and I'm funny. I talk funny. What I value most about Asheville is the diversity of the healthcare system. When I moved from New Orleans, I thought it was just a dinky little town that had no health care. We used to fly back to New Orleans with my husband. And after being here a little while, I realized this is awesome. It's such a little place with 4 big buildings at the time. This was just awesome health care. And I really long told you sitting there with Carol, you have worked really, really hard to make this happen. And I'm so proud. I have served on the board for a while, and I'm so very proud. And yes, I do consider this home, although I talk funny, so get over it.
Winnie was also the chair of the health board.
And I'm a cardiac nurse. That's my passion.
I'm David Begley from White Mountain, and recently retired from White Mountain Savings Bank. I've been in about 28 years. Before that, I was a small claims judge, about 5.5 years here from the 8th Judicial District. I'm currently the chairman of the county's park rec, Greenway and been doing that for a few years now. I've lived here all my life, and my wife is from Louisiana, by the way. Met her at Ridgecrest many years ago. But I value the diversity here, like you were saying, the progressiveness. There is a lot of diversity in people and things that you can do. Of course, I guess, recreation is really important to me. I've got 2 young, well, they're not too young now, they're in their 20s, but 2 boys that were heavily involved in recreation with the school system here. And it's just a great place to live and raise a family. I appreciate the opportunity.
Although she's not on the board, she's a valuable person. So it keeps us all straight, working very closely with the Human Services Department. Dr. Oliver.
Hey, I'm Richard Oliver. I'm been there in North Carolina State Department of Agriculture, Director of the Western Animal Disease Diagnostic Lab. We assist veterinarians and owners in infectious diseases. Wow. Okay. What I want to say about this community is the emotional, mental, and physical vigor, and the diversity. Other than that, it's okay.
I'm Don Locke, Professor Emeritus at NC State University. I came to Asheville in 1993 to direct the doctoral program for NC State University at the Asheville Graduate Center. Retired from NC State after 30 years. Worked at UNC Asheville for 2 years. I'm also a licensed psychologist. I've headed the Department of Counselor Education at NC State. I love the focus on education in this community. I consider myself an educator, and from the preschool levels all the way through higher education, and particularly when I travel, I say we have America's best community college right here, ABTech. It stands for America's Best. And we have a university that is unique. We have other programs that are supported by the city and county that support education, and I just find that very attractive and comforting.
Hello, my name is Stephanie Kaiser, and I am a licensed pharmacist in the state of North Carolina. I actually work at Mission Hospitals, and I arrived in Asheville in 1994, and married into a local family. Some of you may have remembered Montford Pharmacy back in the day, long ago. No one in the family went into pharmacy, so they had to marry one back in. But I work at Mission Hospital, and my title there is Executive Director of Community Health and Corporate Wellness. And it gives me a really broad and unique perspective of engaging with a lot of you on a lot of projects, so there are many familiar faces to me. I have been delighted to be a part of our wellness efforts, bringing wellness to our employees at Mission. That's a continuous journey. We learn a lot every day. And I think one of the things I value about this community, there are many things I value about this community, being a native North Carolinian growing up in another part of the state, I think I greatly appreciate the fact that this community is often very open to discussing problems in a solution-based way, not in a, oh, well, that's just how we've always done it, and this can't be changed. So I really do think that makes us uniquely different and sets us apart, and it seems that this board is pretty much a testament to that in terms of what's been brought together.
Hi, I'm Rick Weigel. I'm a psychiatrist, and I'm the medical director for the Department of Psychiatry at Mission Hospital. I also provide med management for the Buncombe County Detention Center. My background is in forensic psychiatry, and my clinical work at Mission Hospital focuses on what's called the PEA, which is the psychiatric part of the Mission Emergency Room. As far as what I love about Asheville, my family and I moved down here about 3 years ago, and we spent my wife and I spent our whole adult lives in New York City, and wanted to find a place that was progressive and arts friendly and had good food and was beautiful, and so everybody pointed us to Asheville. And when we came here, the thing that struck us the most about it was that everybody here loves being here. I'd never been to a place where there was almost a virtual absence of cynicism, and people just were so focused on their community and so much in love with being here. And that's been our experience since we've been here.
Hi, my name is Jennifer Wade. I'm the Executive Director with Community Care of Western North Carolina. We are one of 14 independent networks operating under Community Care of North Carolina, which is a public-private partnership between HHS, the Division of Medical Assistance, and physicians and stakeholders with the Medicaid population across the state. So we employ care managers, quality improvement specialists, pharmacists, and others to support primary care practices and the delivery of quality health care. And we serve, my network serves 8 counties. Our main office is located here in Buncombe County, but we have roughly 40 care managers that are posted throughout the communities directly in primary care practices, working on the ground, partnering to improve quality of care. I came to Asheville in 1991, actually. I definitely consider it home. And what I love about this community is the sense of collaboration. I've not experienced it anywhere else, but the way in which we really are
are willing to come together and to solve problems, as Stephanie mentioned. So, sense of collaboration.
Hello, my name is Bill Riles, and I'm the dentist. I'm Division Director of Dentistry over at Mayhack, and my responsibility there includes supervision of a large dental clinic as well as the supervision of a postgraduate dental residency program. We have 4, soon to be 6 residents that come to spend an extra year with us in postgraduate education. I'm also dental director at Blue Ridge Community Health Services out in Henderson. So in that combined capacity, we actually participate in betterment, improvement of oral health to a large extent, the entire community here, both here in Asheville and Henderson County, but also we serve a large population that's underserved. Out in Blue Ridge, our area is like 70%, 7 out of 10 people have no insurance. And so we really are on the front line, so to speak, as it relates to oral health care, partnering up with our medical colleagues in an area that's extremely important, that's underserved. I've only been here in Asheville for 6 months, but what has really impressed me about the community fact that I've never lived in a community where so many people who are focused on healthy living. Maybe it's the mountains, I don't know, but from food to exercise, there seems to be a strong community spirit that speaks to health as a healthcare provider that really touches me. And both my family as well as myself, we love it here so far.
This is incredible, isn't it? I mean, I don't know how this group got together in one room, but I am impressed. This is incredible. My name's Carol Peterson, County Commissioner. I'm just finishing my 2nd term. If you'll give me a minute, I can go into that campaign speech. But I will not do that. I'm honored to be a part of this group, and after hearing the information that these great folks have shared, I know that this is just the beginning of great things. And what I value about this community is every citizen who resides here. And the fact that your county government works every day to make every citizen in Buncombe County the best they can be it education, health, recreation, keeping them safe, whatever it is. We work every day to make sure that happens. And to be a part of this group is awesome. I don't know how you all did this. This is incredible. Wow.
Why don't you tell us what you're doing, Cindy? I don't. Michael Frew, I'm the Buncombe County Attorney, and I'm going to sit with this board and do what needs to be done. Whether that's just giving legal advice or not. The community thing struck me. I mean, I had the privilege of being born and raised here, and I'm just happy to be able to be a part of the community. And anything you can do, just ask. We're glad you're here. You want to tell or you want to wait?
Hey, I can. I'm Andy Stein. I think I've had the pleasure of meeting almost all of you all, and so honored to be Buncombe County's first Health and Human Services Director. I, like Michael, was born and raised here. Most of my family, almost all my family, still resides here. And just very proud to be able to contribute as an employee and as a citizen to work in the community. I come to work every day, and I mean every day, 7 days a week. I'm very engaged about what we do and very honored to work with both the team I have the honor to work with in this board and to be led by a board of commissioners who was forward thinking enough to make this happen. And that's true. What I admire about this community is it's a courageous community. It will go where others have not gone. Not afraid to make mistakes, to push the envelope and take us to a better place. And that's probably the thing I'm most about.
Thank you. One of the things that I agree with Ms. Peterson, the fact that this is an amazing group of people
we have a job to do, and each one of you are here because you have a specific role that you can play when that issue comes up, that you have some expertise in. And I think it's wonderful. And when I saw the name, I said, my heavens alive. It's just great that you wanted to be a part of this, and we certainly appreciate it. Now, I want people who you're going to learn to respect, you're going to learn to appreciate, because this is a leadership team that's sitting in front of us, and they're the people that make this thing happen. And they played a big role in making this particular process, and they're responsible to make sure it's merged together and everything else. So, Jim, we'll start with you and go from there.
Good afternoon. I'm Jim Holland. I'm the Director of the Health and Services Support Team. And in that role, we work to be the link across all of the departments that are under Health and Human Services. And we also work to serve as a link between the physical components that are essential in order for us to run and the programmatic components that actually deliver the services to the citizens. And our goal is to make sure that those work seamlessly together so that we're able to accomplish the goals that we need to do. And it's a privilege to be here at this historic time and to be a part of working with all of you, and I look forward to the many opportunities that we'll have together. Thank you.
Good afternoon. I'm Lisa Evie, and I'm the Head of Human Resources and Consumer Affairs for Health and Human Services. And I've worked very closely with Mandy and Bibby and Fran and Steve and all the people here to try and help them mobilize the capital they have in the employees to do the work that they need to do. What I value most about Buncombe County is, I think, articulated in this room in that we are a very rich and diverse community, and that we can get mired in the divisiveness of politics at a federal level, but here at the local government level, we make things happen. We do it in a solution-focused way, we do it in a courageous way, and that's what makes me really proud to do this.
And Lisa had a big part in making this all come to what you see today. So anyway, thank you, Lisa. I know other people were involved with it, but you played a major role. Go ahead, Amy.
I'm Angela Pittman. I'm a social work director of both adult and child protective services. And I have been in this role. Well, I returned to Buncombe County in 2005, but I started my career here when Mandy hired me as a baby social worker. Very young social worker. That's right. One of the things I value most about this community is that we are forward-thinking and future-thinking community, and we always have the citizen in mind. We're always trying to figure out what's going to work best for the citizen versus what's going to work best for the organizations in the community. And I really value that working relationship with all the partners sitting around this room.
My name is Steve Peterson. I'm the Economic Services Program Director. We're looking forward to working with you all in regards to what we do on the public assistance side. We deal with all aspects of public assistance, including food nutrition services, Medicaid, adult children, Medicaid pregnant women, MIC, and all those various programs, and also Medicaid transportation. We also deal with child support and child substitution, child care, food nutrition services. I want to take a second, if I could, real quick, Chair, to introduce a couple of the department heads we have. Vicky Coleman, Vicky, can you stand up, please? He's with our adult Medicaid division. And Marty Phillips, he's with our food nutrition services. And Tricia Long, who could not be here today, she's representing us very well. We do look forward to the opportunity to work with each other.
So we have to back up, yeah. And so my folks, Jennifer Children, he's probably he's new and he's already like doing me shame. Jennifer Chilton is our adult services and other things, program administrator. We have Tammy Shook, who's been with Buncombe County for a very long time. It's a good thing. She's the program administrator for investigations and child services. Dawn Warren, who is our family in-home program administrator. Becky Kessel, who many of you know, is in Raleigh today doing a presentation, and she's our program administrator for adult. And then Suzanne Smith is our managing attorney, and she's also not here today. But you'll see those folks at future meetings.
Lisa, do you have anybody?
I do. I have Amy Davis, who's over here, that is the better part of my brain on most days. And I want to also just recognize Krista as well, who is Mandy's administrative assistant, but she does everything I ask her and more, so she helps a lot.
You remember one name about you, it's crazy. When you need something, it's crazy.
The folks that are here today from the Health and Human Services Support Team are a group that you will have lots of interactions with at the support level, and those are the planner evaluators, and they are the link between the physical and program components of Health and Human Services. And there are 3 of 5 of them, or 4 or 5 of them are here. Christina McEntee, she works with the Social Work Division. Rob Morrow, who works with the Public Assistance and Economic Services. Julie Montanea, who is our data analysis and IT link with linking performance measures and outcomes to the program. She's taken a lead in that. And Dr. Rich Munger is an evaluator who works closely with behavioral health in all aspects that the county works with. Is that huge area, and great opportunities that we have to do that. Also, Human Services Support Team, folks who are not, Karen Smith is, I'm sorry, I didn't see Karen. Karen Smith is another planner evaluator, and she works with health and Parks, Ways, and Recreation. Other folks that are within the Health and Human Services are operations folks, and the finance and accounting of Health and DSS.
Okay, Randy, see if you make it work.
Good afternoon, my name is Fran Thigpen. I work with the Parks, Greenways, and Recreation Department. I value the fact that Parks, Greenways, and Recreation is a part of the Consolidated Health and Human Services team and organization. I think that it's, I appreciate being part of the group that's up here and being able to work with our services and learn so much of other ways that we can be of value to a community through Parks, Greenways, and Recreation. We believe that Parks, Greenways, and Recreation is about health and wellness. We hope that we can continue to be a strong voice for facilities and programs and expansion of opportunities for families and children through Health and Human Services. I appreciate it very much, and that's what I value as an opportunity to be here. I appreciate our chairman of Parks, Greenways, and Recreation Advisory Board also being having a place in this very important setting. Thank you very much.
I'm Debbie Harris. I'm the director of the Department of Health. Our job is to protect and promote health in this community and to ensure access to services. You'll learn a lot more about what we do as time goes on. Some of you already know. Appreciate that. And I have been here for not quite 4 years. Have lived in several other communities, and the one thing that's impressed me about Buncombe County, lots of communities say they take care of their own, but this community doesn't. If there are issues that are out there, people come together to try to figure out how to solve them, and it's been very effective since I've been here, the partnerships and the relationships that are out there. And I have to say that there's not one person on this board that I don't see benefiting the work that we do and providing strong input into that. So I'm very grateful that this group has come together and the opportunity to work with you around that. I've got some staff in the room. Bill Gregory is over our community health programs. That's a lot of our outreach work, our health promotion, those sorts of efforts. Eddie Shook is here. He's over protection and preparedness. He works with environmental health and with preparedness and with accreditation and with quality improvement and a number of other areas like that. In the back, we have Linda T. Campbell, who is over our clinical services, and Dr. Jenny Mullendorf, who is our medical director. And I look forward to y'all getting to know this folks. Thank you for being here.
Well, one of the things we want to make sure that this board gets to know each other as well as the staff that will be reporting and talking with and bringing things to it. I think that, Mandy, are you going to explain about why the board is set up this way and so forth? I believe that one thing that I want to say that I didn't say first is I know some of you will possibly be on call. Most of the time we say cut off all your iPhones and so forth, but if you don't call, don't worry about it going off, and I hope it doesn't go off. But we normally try to keep it to an hour and a half, and we shall go that route. And one other thing we have with us today Sharon West, who is a representative from VA Hospital. She is a nurse, and she was also our interim health director until we got Gibby. So she will be in the next one, and Dr. Whitman is a optometrist. I have to think what he was and he is in a big conference, and he will also be here with him. And he is also a member of the health board. It's fast. Okay, Mandy.
I'm going to talk a little bit about just what the school is intended to do under the law and what the commissioner's vision is in addition to what North Carolina General Statute says. Our challenge as we go through orientation is to help them understand both the significance of the responsibility of this board and to not frighten you so that you don't come back, because as you heard all of those program areas and the significant impact we have both in terms of managing public dollars and programs that touching citizens, it is a really important board from a leadership perspective. And what I would want each of you to hear from us is you were selected not just because you fit a category that's outlined in the law, but because you each represent a broader vision for our community. You look at the whole of the community, and you look, each of you talked a little bit about that, how you might have a professional or a credential or background or education or even in your job that you view the community from a broader perspective. And that's exactly what we need in leadership in this board. Interestingly, in the history of North Carolina, to consolidate social services and health has been very controversial. If you watch the debate, we're going to talk a little bit about that. The history over the years has been very focused on the government. And I think that I would say, and he may have a different perspective of that, on a state level, it's always been somehow perceived that if you consolidated or merged the two, you weakened one or the other. And I think Buncombe has never understood that perspective. Buncombe has always believed if you focus, and that's why you see these pictures, if you focus on the citizens, as Angie said, and you look at how the citizens need to receive services and support it holistically, and if that is your focus, what you believe is that each of the individuals up here bring a special perspective, a unique perspective in education and background that will make us stronger when we try to approach leadership from that merged vision. And that's really what's driven the commissioners. I think Commissioner Peterson said it best in 2005 at a retreat when she said, hey, let's just talk about citizens for a minute. And they really don't care about silos and buildings. They care about getting their needs met from their local government, and that needs to be what drives every decision we make. I really just want to touch on this, that Buncombe has been working to take us to the place we are today for a very long time. As early as 1992, they established a community commission to work on simplified access. How can people access services for DSS and health in a more simplified approach? In 2001, they established a blue-ribbon committee to focus on that. They began doing site visits to Wake and Mecklenburg, which were the two counties who had consolidated and were allowed by law to consolidate. In 2006, they began advocating on a state level for both their County Commissioners Association to adopt this as an advocacy issue and for change in legislation. And it took until this last legislative session for it to pass, because many people argue the work that public health does and the work that social service does are too important. They both need their own boards. We argued and continue to argue that They both serve the same people in the same community, and there's a way to do it more efficiently and from a more evidence-based perspective and achieve better outcomes, both for individuals, families, and the community. That actually got passed in July. And our commissioners, we did the things that the statute required us to do, and I'll talk about those in a minute that bring us to today. As early as 2005, the county manager consulted with the school of government and said, DSS and health also answer or arms the state and federal government. What role does the county have in the governance of those two? And what the Institute of Government clearly said is you control their budget and their people, their staff, their human resources. She took all of those functions and consolidated them in Jim's team, the Human Service Support Team, as early as 2005. And that's kind of the beginning of this journey. I wanted to give you background because I think when we begin to understand the significance of what this board will be, I will begin with, if you look at the overall county budget, the parts that fund health and DSS to a large part are the intergovernment component, which makes up about 16% of the county's revenues. When you look at, when you look at the next slide, that's relevant because we are responsible for 30% of the expenditures from a county perspective. The only other larger expenditure, and I'll actually see those numbers flip a little bit because what's joined Human Services used to be education. But in this last budget, we actually surpassed that education component of expenditures in the county budget. When you look at that 30%, 69% of that expenditure relates to DSS. Those are federally mandated programs. One of the things you'll see as we move through this is about 98% of the DSS budget is mandated by law. Counties don't have a choice about the delivery of it. They certainly have a choice about the investment they're willing to make to improve the quality of the services they delivered, and Buncombe does a very good job of that. About 22% is around public health, parks, greenway, and recreation about 4%, and behavioral health about 3%. And in Jim's team, the administration of all of those is about 2%. We also make up 40% of the county workforce. Since the creation of the Health and Human Services team, we've realized $4.5 million in savings through efficiency, streamlined access, investing dollars in evidence-based programming and prevention programs. Dr. Munger is the one that really holds our feet to the fire about making sure we invest in preventive programs around behavioral health. And because of the way that the county built this system, we're allowed to reinvest that into core services. This is important for you as citizens and because you will assume responsibility for making budget recommendations to understand how does Buncombe compare to other urban counties. And our comparison group are the larger counties, the urban counties in the state. We have the second lowest tax rate in the state of North Carolina. I'll show you a little flip of that to show you that our tax rate has remained stable since 2008 and actually dropped a little in 2007. And I'd ask you to look at the top line of that. Those are the number of citizens that DSS and Health directly touched last year. That's not accounting for the fact we all eat in restaurants or all of our children attend child care centers where we have responsibility for licensure components or subsidy components or monitoring components. Those are people who actually touch them for direct service. 120,000 of our 248,000 citizens received direct service from us last year. I think child safety is a great place for me to just touch on quickly because that's one of the first places we began to understand. While DSS has a responsibility by law for the protection of children, public health has historically certainly done more work and been more driven on the prevention side and how do we actually influence outcomes for families much earlier on, that early intervention. So this began to be kind of a touchstone for us that if all we focus on is protecting children as reports come in, we're really not making changes in our community. We may change those individuals, families we touch, but we have to get better at connecting risk, providing those preventive and early intervention services. And through that, what all the research tells us is they'll do better in school, they'll do better socially, they're less likely to get involved in the criminal justice system. So I just share that as an example really early on when we first began having conversations related to why it made sense to move to a merged system. This is just an example of some of the data you'll see as we bring you programs and we bring you budget. This is us beginning to use county resources, geomapping, something we never did in the past, where we're actually looking at families we touch through our social work division or individuals and connecting those to school districts and connecting those to where community health has also delivered a direct service, and how that also helped shape for us the opportunities to work in a more consolidated and more strategic manner. These are some examples of some collaboration since we began moving toward this merger. I say, and I'm not really real proud of it, that it was typical for us to go initiate an investigation of a child in a county or city school. There'd be a school nurse, and for the social worker and the school nurse to never talk, never touch. And for whatever reason, it never came naturally to say that ought to happen. It's as we began that merger process, we said we need formal agreements about how that happens. We need to be doing cross-education. The school nurses are critical sources of information to the child protective social worker. And the child protective social worker has critical information about that family that will benefit school nurses. And these are just other examples of that type of collaboration. Same thing happened when you look at parks, greenway, and recreation. I love Fran's comment. On a county level across states and nations, they debate all the time. Is parks, greenways, and recreation a planning function or a health and human service function? And there are parts of both in there. But I think that what one agree our county manager's always gotten and Fran's always gotten is that while the reason the county invests in greenways and recreation and parks is to impact health and wellness of families and individuals. So it very much is a part of how we move forward. These are some great examples that we worked on as we moved toward merger that connect public health and DSS. I'll highlight Valley Child Care was a center we ran like any other child care center. As we began looking at outsourcing child care centers, saying, is that really the business counties ought to be in? We looked at around specific to Valley because it's connected to a county school that serves at-risk high schoolers and unwed parents or wed parents who are young and have children. That why not take that center and make it about child abuse prevention and support. And as Tony Baldwin, our superintendent, said to me, which probably flipped my switch about advocating to keep this service, it's a dropout prevention service. Not one, he said to me, of those parents will walk across that stage and graduated high school without that child care center. So stop looking at it as county investing in the direct child care center and look at it as a child investing in dropout prevention and child abuse prevention, and help, and how do we promote health and wellness and education around that very young children. And that's another example of how you take something you've done for years, but look at it in a different way, invest resources in a different way, and measure your success in a different way. This is just another example of where we use mapping, and in this one, what Fran and Fran's office has done is look at where our parks are, and our recreational facilities, and where county and city schools are, and where are they connected, and where's there opportunity for us to promote greenway growth and parks growth in a place close to where children and families and individuals live. That's the kind of data that we want this board to be able to use is to help drive how we do deploy our resources. Those are just some other examples which are up around the ribbon and in the hallway. And what we need from you all is, as you see examples of data you need, we may not have thought to look at it that way, tell us and we can deliver those. This is something we've worked long and hard at. For those of you who have not been to COPS, that'll be a part of our orientation over the next several months, but we took what was our DSS building and built the integrated health and human service system. And now individuals go to one place, there's no wrong door, they don't get sent from building to building, and they can access all those services through a consolidated intake and a consolidated data system. These are just examples of all the ways we, with the help of county IT, have built information systems that support how we serve our citizens, not requiring that everybody, most of who we serve, work. Not everybody has to come uptown for every service. They can apply with a phone, they can apply in their own communities, they can apply via libraries, self-serve kiosks. That'll be a direction the board helps us take another step as we move forward. We went out and did community listening sessions over the last year. We worked with a consultants group to do that. These are where they happen. And we'll go into the detail of those later, but I will tell you what they all told us. Both providers and citizens and consumers is we wish you were more coordinated. We wish county departments weren't so siloed. That's the exact direction to go in. And we wish you did a better job in providing us with more information about what you do deliver. And that will be a focus of where we go, particularly through Lisa's advisory board. House bill passed, and that's what brought you all to the table. It allowed boards of commissioners to not only consolidate health and DSS, but to bring other county services into the consolidated system. That's an example of Parks, Greenway, Recreation, and Veteran Services, behavioral health, which we also view as a component of this board. All of the boards appointed by the county commissioners, and that is different. DSS boards, half of them were appointed by the state and half by the county commissioners. So from a county perspective, it allows the county commissioners to select people who they know are engaged in the community and invested in the outcomes. The board was required under the new statute to appoint a nominating committee. They did that. They chose all of the former DSS or health chairs who are still on either board to serve as that nominating committee. And it is that nominating committee who took the rest of your names to the Board of Commissioners. The Board of Commissioners adopted that, as well as our operating procedures, our meeting schedule, just the framework of how we move forward. And we'll go through that. These are all legal requirements that are spelled out in statute, and again, many of you need those, but that is not why you were chosen. You were chosen because you bring that broader perspective, and we need that as we move forward. One of the changes, which we think is very positive, is a requirement for consumer or public advocates to be represented on the board, to have that consumer voice at a board level. I think we're good with all of those pieces. Members of the executive board that were appointed by the board. I want to talk just a little bit about the board structure. These are the advisory committees. We have an Economic Services Advisory Committee, Parks, Greenway, Recreation, Social Work, Public Health, and Consumer. Board members can choose to serve on one or many of them. I know many of you have been heavily recruited to serve on one or more of them. Some board members have done that. Some have said, I want to get the orientation and better understand what each program does before I decide. But you'll be hearing more and more about those advisory boards and the structures of programs as we move forward. We did want to say, and it is in the formal rules that have been adopted, the role of those advisory boards is they are the connection to this board. They bring recommendations about budget, fees, and policies, program additions or changes. So those advisory boards will be the group of community experts who actually feed that information up. They promote evidence-based practice. They hold us accountable that we're investing public money in programs that are proven to work. We want and expect those boards to drive innovation and change, to model cultural competence, and to serve as a leadership coalition. Whether it's public health or Parks, Greenway, Recreation, or social work, we want it to be the leadership of the community in those areas who can come together and identify and solve problems and move us forward. The authorities that this board have are basically all of the authorities that either the DSS or the health boards had in prior legislation. And you'll hear more about those as we go into formal orientation at future meetings. The role and responsibility of the director are about the branding. It's important that we hear our citizens say we better need to understand what gets delivered through Health and Human Services and how it does. So I think that's a responsibility. How we manage the coordination and integration of Health and Human Services. This is the leadership team you've met, and they're in your actual notebooks. You have their cell numbers in addition, and their phone numbers at the work in addition to their organizational charts. And these are, this is interesting that while North Carolina in many pockets has resisted consolidation, all of the national research says it works. And these are all the reasons all the national research says that it works to consolidate your health and human services. And those are about not only client needs, but if you look through that, they're proven to more efficiently use public dollars and to build a stronger workforce that's able to respond to the comprehensive health and human service needs of your community. And that will be the question that drives us as a board. How do we integrate safety and wellness into every aspect of community life? And that's an overview. You want to walk through nothing? Sure. Quick, or you want to do your exercise and then walk through nothing? Let's do your exercise.
I think we'll start with the exercise, actually. We were really fortunate just this past week, to have Robert Livingston come and speak to us. Deb Miles is here from the Center of Diversity Education. She's at UNCA, and she was, through partnership with them, we were able to bring him to speak to our management team. And he told many very important stories, and also told us about very important work that's being done that's evidence-based work research. But one of the stories that really resonated with me and seems to tie in with what was said about what you value about this community is he talked about, and Don, you can correct me if I don't remember the story correctly or anyone else that was in the room, but he talked about a team that came together to solve a problem about housing in a community, was it an African community? It was in a community where it was a very warm climate, and they didn't have the electricity available to them to make the housing project cool. And so they brought together, he said that the typical, what you would typically think to do would bring the best architects into the room, but they didn't. They brought in architects, they brought in anthropologists, they brought in entomologists, and so on. They brought in this rich, diverse team of people. And it was the entomologists that solved the problem. And what he realized was that the termites who lived very well in that community were dependent on cooling systems in their tunnels because they had a very narrow bandwidth for regulating their internal temperature. And so that they had to build these sophisticated tunnels in order for them to survive. And so the entomologists went and studied these tunnels, and working then in partnership with the other members of the team, the architects, the scientists, the engineers, they were able to construct a housing project that kept cool without electricity. So, you know, you guys are sitting here with this vast array of experience and perspective. It's a rich and diverse team, and we're hoping that you're going to bring that to this work that we do. So I just wanted to tell that story because it really resonated with me when he came and spoke to us. And again, it's just another indication of this wonderful partnership that we create through the Center for Diversity Education. The county has been working with them now for 2 years, and we're very much more enriched because of that. So we'll turn that down. Okay, so the first thing I wanted to do was just to start a little small exercise. Let's see. That's all good. Okay, so I'm going to talk about this girl. And she is 16 years old. And she is pregnant. That's my pregnant girl. I don't know if I do that very well, but she's pregnant. So I want you guys, because most of you guys in some way in the work that you've done have met this girl, right? So help me fill in some of the details potentially of what her life is like right now. Any ideas? Throw some out.
She's 10th grade.
10th grade, okay.
No work experience or skills.
She's unmarried.
Not graduated.
Lack of credits.
Okay, hold on, wait. She's unmarried.
You do.
Lack of diploma.
Maybe not grandmother. Mother and grandmother, maybe.
What about the father? What do we know about him?
Scared.
Father? So here's the father, right? How old is he, do we think?
17.
Okay. Do you think he's graduated from high school?
No. No.
Okay, do you think he's had any contact with the juvenile justice system, maybe?
Could be.
Potentially, right? So let's say maybe he's been already in and out, right? Okay, so you're a group of professionals, And as we look at this girl who is 16 years old, and we think about the child potentially that she's going to have, right? When we think about this father that potentially is in her life, what immediate needs as professionals are you thinking about? You know, we talked about the resources in this community, so what immediate needs are we talking about? Excuse me?
Prenatal care.
Prenatal care, okay.
Student for community high school so that she can have access to Valley parenting education.
That's where we put that.
Needs to be a student at community high school so she has access to Valley child care parenting.
So child care, right? Would that work? A lot, right, Suzanne?
She needs a mother love program. I know the mother love program, that's why I say that. I don't know how else to describe it, but it's she needs someone like herself who is going to be a source of strength. Call her like a posse almost. There's a lot of literature about mentors and posses. She needs that.
Okay, anything else? What about for the child? What do we need for the child? Well, you know, there's dads who are parents, right? Let's talk about that, because really, if you don't have the basics, it really doesn't do much good when these other more sophisticated things are, you know, being asked of you, right? So what else? Wait. Women, infant, and children's food.
Needs health care now. I don't know if that's assumed under prenatal care, but there really is a need for health care.
Excuse me?
Try
not to use all those acronyms here. Anything else? Immunizations? So you saying child support?
Potentially nurse-family partnership if this is her first child.
Nurse-family partnership, which is an integrated approach to serving first-time moms who are at high risk. What about the dad? What does he need?
A job.
A job, okay. It's interesting that you say he needs a job. What about her? Are there many families that can do well on one income anymore? It's hard, isn't it? So, job, what else does he need? What does he need to get a job?
Education. To graduate.
Need a scooter.
A scooter? Well, you laugh about that, but a lot of people that lose their license are driving scooters because you don't have to have a license to drive a scooter. Anything
You
else?
also need sex education, because apparently he didn't have good education prior to impregnating that young woman.
Okay.
She needs somebody to help keep her in school.
So childcare at health school helps with that. I think we're potentially doing that, but the idea being that she needs to stay in school and graduate, right? And why do you want her to graduate from school?
Because if she doesn't, she would be among the most poor people in our country.
Right, we know statistically that people who graduate from high school and then from college make a whole lot more money than people that don't, right? So as we look at this, what does it say about what we value as a community? I mean, what we say these are their needs, right? So we're up here in a room. What does it say we value as a community?
They're caring.
Everybody's well-being.
Huh?
Well-being.
Well-being. I remember which marker I can use on which board, and that is the wrong one. So well-being, we're saying?
For everyone.
Right.
For everyone well-being.
Education.
Well-being it covers a broad as well as the education. So we flip over and we go from this individualized look at what they need, and we think in a broader term about our community, because so often I think we The way we, this is part about always pushing them over in our community. This is new for us, but at any rate, I'm good. I appreciate you working with me. But when we think about our community, and I don't know how many of you are familiar with the work of Peter Block, but as a community, we also have hopes and expectations for our citizens, right? That it's not just about them and them looking to our community, but what are we looking towards them for? And what are our hopes for them as individuals when we think about this mother and the child that she's having and the son? What do we want as a community for them, right? I mean,
active participants. We
right.
want them to participate. Pay my Social Security.
Okay, so active participants, and that's a great umbrella thing because you can talk about that financially contribute, right?
Yeah.
But what other ways might they contribute to our community?
Maybe the next cancer cure from that person who's all kinds of possibilities.
To the degree that this young girl and this young man are able to raise a child in a loving home or in a loving way, what do they model for the rest of the community?
I think what you're driving at, I think one of the best things that a young lady can do is for the community is her own family. What is it? The stability of her nuclear family, what is that going to be like, particularly as they enter into school and she in the workforce of it. But that's probably what she can do more than anything else for society is to have a stable nuclear family.
You're sort of starting to get on sustainability.
To be good citizens, contributing citizens.
A role model.
Part of what I wanted to do is reframe this conversation. What I wanted us to think in terms of was that, oh gosh, I really miss chalkboards. Feeling that old erasing, it feels good. The small things in life. What I wanted us to think about is that for every child that we lose, every young girl we lose, every young man that we lose, right? And I think that gets lost oftentimes in the conversation when we start talking about people that come into the system and are needing support, which is what we do. We give them support so that we'll keep them whole so that they can contribute, right? And so I think it's really important for us as we move through this process and we talk about integrating services and we talk about bringing our eyes and our knowledge and our perspective to this situation, that we keep in turn, we keep this in our forefront, that communities, already here, communities that strengthen the ability to make good choices and also remove obstacles, are communities that allow people to choose health, safety, and well-being. That as we think of this dynamic that we're trying to create, where we have a young girl and a young child potentially out of that relationship, and a young man, that as they live, they work, they play, they learn, and for some pray, that it's within this context, within our community, and within the different areas that you are bringing to this table, that we will create people that contribute, give us their ideas. Yes, contribute to the tax base, and our role models for creating a safe, healthy, and thriving community, which is what Health and Human Services is all about. So just wanted to kind of walk through that with you guys and give a context for that, because I don't want us ever to lose sight of, again, that we're dealing with individuals, but we're also talking about the work that we do as a community and how we build a community and how we sustain a community that is safe and healthy, and it emulates well-being. So you have some articles in your on your board packet that I think are really important. I started getting into this whole concept of community builder, and a lot of the things I like about them is they really talk about the scope of influence from countywide versus neighborhood, you know, helping you to look at it from different levels. I like the fact that they say to you, like, what values do your interventions reflect? To put that on us, I mean, I could also look at all this, and we could ask what kind of a different life does these children potentially have if they're white, or they're of color, or they're different ethnic, or they have disabilities. You know, I think we as individuals on this board need to be thinking in terms of those things and making sure that we understand what theories we're working under, you know, what values we're bringing to the table about what we think is important. When you look at this, we're saying what we really think is important is education, because we're talking about being able to keep both of them in school with childcare and other things so that they can get educated, so that they can get a job. That's very important to us. So what are the values that underpin the decisions that we'll make as a board? And what are the assumptions that we make with those values? We're assuming that good education leads to good jobs, that leads potentially, I'm assuming, to family stability, in the sense that you have permanence, that you have self-sufficiency, right? So did anyone have a chance to read the articles before they got here? Did you find them interesting? I think that health has done a really good job in leading the way through the Robert Wood Johnson Foundation, which is just an amazing group. I actually worked with them on a project a couple years ago, which I laughed. I had just gotten my job with Jim Holland said, I've got this little project to take about 5% of your time. It's really not a big deal. 70% of my time later, it was done. But anyway, I think that it's important for us to take this integrated approach and again, use those examples that Mandy highlighted in the PowerPoint as a driving force for, again, for us to look at things differently and to think about ways of approaching these situations, but always being aware of where we're heading in the context within which we're working. So that's all I wanted to do with this. Any thoughts or feedback? It's always like a big experiment mess, and I never know if it's going to work.
Just briefly, I appreciate what you said. It made me think about what you said about the community and the lack of cynicism. And I see cynicism as being what comes through the vacuum instead of something replacing it. And, you know, maybe we are working towards this thing, and maybe if you can inspire the people and let them have hope and let them see a way out, a little bit powerful is the lack of cynicism. Because that's pervasive. And I appreciate what you did here.
I think local government has that unique ability to get things done in ways that you can't always get done because you lose, you know, the power is so disconnected from the ground troops, right? So I think here we have that ability.
Thank you. Another thing that I should have said that I like about this community at the national level, the word poverty and poor has not been mentioned in the campaign for president, and we're talking about it here in our community. And I think that's important because not only are the poor people my neighbors and my friends and acquaintances, they are also our responsibility. And I think that's another thing that I like about this community, and I like about this role that we're dealing with hard issues, tough issues that are unsolvable in some respects, but nevertheless we go after it. And I value that in this community.
Any other thoughts?
I'll touch, and Lisa, you can help me through this, real briefly on what's in your notebook. I want to talk more from a broad perspective about kind of our framework for orientation, which we will adjust based on what you tell us. We work for you, so you need to tell us if we don't move in the right direction. Probably at our next meeting, we'll only try to schedule one between November and December with all the holidays. We'll focus on the financial components, more understanding of the budget, what drives our budget and our revenues, and how we tie finance to performance and programs and what the link is, which is what drives everything for us. Then in January, we have Tom DeViek, who's an economist, who's coming to give us the state of the economy in Buncombe County. As we move forward, I think it's really important for this board to understand demographic trends for our county, wages and work trends, education trends. He will look at all those components, housing, because we will influence all those things. This board will make decisions on everything from priorities in the new Greenway plan to appointing the Greenway and the Parks and Recreation Commission, to how do we address affordable housing in the county versus the city and what models should we be using, to the more easily recognized components of DSS and health. After Tom comes in January, each of the division heads will do a drill down 1 month. So there'll be a month where you really do understand what sits in Gibby's department, what are our responsibilities under the law, what are some of the highlights of what we're currently doing, what are some of the unmet needs that will drive the work of the board. You'll hear that from each of the division heads. Then we'll do a wrap-up, and then we'll come back to what will be our standing board format. And we're hoping after that orientation, y'all can better advise us what would work better for you as a board about that ongoing format, although we have a template in here of an agenda. What is in your notebook, and you never have to bring these notebooks back. We will always send you electronically your board materials. We will always have your iPads here up and ready to go for you. But these are for you to keep and use in whatever way works for you. We did include who the other board members are, so you have that contact list, who your peers are. Also include who have currently committed to any of the community advisory committees. There's some slots that have not been filled there, but we think that's important because those will be the individuals who will be feeding recommendations up to you out of the individual areas, and many of you will be serving with them on the steering committee. Provided some your actual rules for operations, which are still in draft form and we're continuing to refine, but once you have the opportunity to look at those, the organizational chart for the board, some of the history, the Health and Human Service organizational chart. So again, who are each of these people? What's their scope of responsibility, and how can you reach them if you have a question or need, or it's all included in there. The budget components, and then and I think public health, the statutes that govern our work or require our work, and then public health may be the first one, but a one-page summary of what sits in that, just so you can begin to get kind of that scope of what levels of responsibility sit in each of the components of public health, social services, and Parks, Greenway, and Recreation. In the back of that, the very last thing are budget guides. This is something that Jim's team does every year. You all will learn that we have very complex budgets, particularly on the social service side. And Jim's team has done a great job for how many years? Gosh, lots of years of producing a citizen's guide to the DSS and health budget that's published on the web. So it's very easily understood in terms of where do the monies come from and what do they support, what are the legal requirements for supporting those programs. And there's copies of those as well. All of that's also available on the website, but just wanted you, for people who wanted some paper to touch, this will be the last you get from us, so enjoy it. In the front of that, we're green when we're not pink. We're often green-handed. Annual reports in here, which is a great summary as well. And something you'll receive every month with your board packet is our performance analyst report. We set our key performance indicators across health and human services and reports out on those. You receive those electronically. If anybody prefers paper copies, if you just let Kristen know, she'll accommodate you too. What we want to tell you is this is your board meeting. We're going to try to provide orientation, but at the end you have to tell us what works best for you, what you need from us as a staff, and how you like information delivered to you. We hope that despite that we're a larger size than we've been in the past in terms of a board, people will feel free to come in a relaxed way, no suits, no ties required, and that it will become more interactive as we move forward. And I appreciate everybody who engaged today, and hope we get to a place where everybody feels comfortable doing that. We are here to serve you, and I mean that collectively. not just the individuals at the leadership table, but this is our leadership team in the room, all of them. And they all have tremendous expertise and tremendous passion for their work, and they're all available to you. So let us know as we move forward how we best support you.
It's not going to be a test on this book.
Just for you, there's
just for you.
It's value education, but I don't value how the evaluations goes on.
Only you will have the test. Main thing about it, it's important, even though some of it you say, well, I don't quite understand or whatever it might be, or I'm not in that particular area. It's important that you, through this orientation, that you understand all the areas that this board will be listening to, will be involved with, and will be making decisions, helping the staff make the decisions. As usual, a board is guided by the staff, keeping us up to date and making sure that we have all the information we need in order to make decisions. And that's what we look forward to them to do, and this staff will do that. There's no problem with that at all. I've been with DSS for ages, a long time. I don't know how many years I've been, but anyway, it's very informative, and it's amazing the steps and where we have gotten to as far as Buncombe County is concerned. It amazes me every time because I can remember when. And as a result, this is important because this board is going to have an opportunity to really make history and show everybody in this state how we should combine the two boards and so forth. There you go. Does anybody have any questions that you would like to bring forth at this particular time? I'm trying to follow the agenda, and they lost me there, but I think we're down to input from board members on needs. Anybody have anything that's you'd like to bring up at this particular time? I love the board that's quiet. You will have a lot of things, and you will play an important part in this thing. Lisa, have you already had your exercise?
Yes, sir.
Now I know where I am. You're down to here.
One thing that we might want to take just a minute and let Gibby touch on yesterday is that we're through accreditation this week, and you might want to, I know you shared that with the health board. Since they were the board during what got you to that place, but
North Carolina has a statute that requires local health department accreditation. Buncombe County was one of the pilot counties, so it was accredited a number of years ago. We have to go through this every 4 years, and it's a matter of meeting a set of standards that have been defined at the state level for public health, and that's built on a number of different categories of requirements that have come from the federal level, which you'll hear more about as we go forward. So there's a connection to what happens in other states as well as here. North Carolina was one of the first states to actually develop an accreditation program and implement that, and the General Assembly decided to make sure that it stuck, so they put it in statute. So we went through our second re-accreditation visit this week. We had site visitors here for 3 days. They reviewed lots of policies. They interviewed several members of our board. They look back. They don't look forward. They're wanting to see what we've been doing, not necessarily what we're getting ready to do, although we did have some conversation about consolidation and what that would mean. So they interviewed Suzanne Swinger and Richard Oliver, as well as some of our community partners. They visited all of our facilities and made sure that, and reviewed lots and lots and lots of records. I mean, the staff has spent the last year putting the documentation together for this accreditation process. They left yesterday afternoon and are recommending full accreditation, re-accreditation for the health department. The board does not meet until the North Carolina Accreditation Board does not meet until December, so it's not formal until then. But we were told yesterday that we were being recommended for accreditation. And I have to tell you, the comments from them were a little overwhelming. They were very positive. The staff, the board involvement, which we expect to continue to happen because this is a board now. But lots of positive comments. There will be 2 reports coming. And once we receive those, we will be sharing those with the board. One will be just the general report, which will have the positive comments in it, which will be nice. The other will be recommendations for quality improvement. So it's an opportunity for us to continue to improve the work that we do. But they were very complimentary. They were impressed with the integrated work that we were doing. They had no concerns about us moving forward as a consolidated organization, and actually commended Buncombe County for the methodical and slow process to implement consolidation, because it's been much more thoughtful than what they're starting to see now that other counties are able to do this. So again, very positive, and I can't commend my staff to they're the ones that actually get the work done. The customer service and the services that they provide all were acknowledged as my visitors. So thank you.
One of the things this board will find out, which has been happening for the last 4 or 5 years, is when the state has a big problem, they always say, well, Buncombe County, will you help us with this, and will you be the guinea pig? And that speaks well for what we have here with health and with DSS, because it's constantly going on. And it's amazing how much they depend upon these 2 departments to help them get through problems, solve problems, and so forth. And you'll learn to appreciate that quite a bit. Next thing, we don't have to have a sign-up for public comment. So I have to ask if there are any comments from the public. Anyone want to make a comment? Okay, we'll close that. Judy, you want to announce who you're taking good pictures of us. You want to tell us who's with you and everything, and we appreciate you working. So if you'll do that, I'll appreciate it.
Okay, I'm Judy Davidson, the talented runner.
BCTV, so recordings will be on BCTV, so public reports.
We certainly appreciate the job that you're doing, and we know that you'll help us out. So, any questions from anyone?
I got one request. Just all you guys start formulating an acronym philosophy. You're going to say peace at one time with people in the assistant and vice versa. Seriously.
The parking attendant indicated that you would tell me something about parking in here.
You can park for free.
I will run upstairs and grab your parking passes. All you need to do is hand me your ticket along with that parking pass and you get out the gate for free.
I think you should have to pay.
Can I correct my number on there, please? It's 213-7194.
Just send it out revised. Anybody else has any corrections on it?
7194.
Another question? Do I hear a motion that we adjourn? On time. So moved, but second. Any questions?
No, you didn't.
All those who agree, you're to leave.
Excuse me just a minute, I want to give a policy.